Hi, this is Dr. Mary Kathleen Figueroa coming to you from the Thyroid channel. If this is your first time, please note this is for educational purposes. If you have specific concerns or complaints, please discuss with your local endocrinologists. Today, we're discussing fatty liver disease and how it relates to thyroid. When thyroid is either high and then blocked by methimazole, or when thyroid is low and not yet controlled with thyroid replacement, you can gain a lot of weight. While this is happening metabolically, you're losing muscle. And while losing muscle and gaining weight, you have developed metabolic syndrome, and secondarily, you can develop fatty liver. Fatty liver disease is very common in the US. Over 60% of people with type 2 diabetes have fatty liver. And fatty liver, while it rarely leads to liver failure, is the number 2 reason for liver transplant in the US currently. How do you avoid the scourge and how do you avoid the complications, including liver failure? Well, first you have to be diagnosed. We're diagnosed with either liver function tests or with an ultrasound. The ultrasound can either be just evaluating for fatty changes, or it can involve something called elastography, which measures how soft and pliable your liver is. After you've had diagnosis of fatty liver disease and ruled out other causes of liver abnormalities, including hepatitis, the next is to try to change your diet and exercise in a way that will help you avoid progression of liver disease. The first thing to do is to change your diet by lowering the concentrated sweets in it, including high fructose corn syrup. The next thing to do is to increase your exercise, particularly increase the amount of muscle development that you do. Increase in muscle mass leads to a higher metabolism and allows your muscles to metabolize more of the sugar that would otherwise cause your liver to become fatty. So in summary, fatty liver disease can happen. It's pretty common in the US. It's the second most common reason for liver transplant. You can identify it early, and if you identify it early, you can reverse it with changes in your diet and exercise. And those changes in diet and exercise include decreasing the amount of sugar you eat, increasing the amount of vegetable matter, and increasing your muscle mass by use of muscle training.